Have you ever heard of a disease known as Alzheimer's in your locality? Welcome to your channel, ADP for Learning. Today, we will dig deep into the topic of Alzheimer's disease by addressing critical questions like: what is Alzheimer's disease? How do people get Alzheimer's disease? What are the symptoms of Alzheimer's disease? How do doctors diagnose Alzheimer's disease? How is Alzheimer's disease treated? So, without further delay, let's start learning about Alzheimer's disease. Alzheimer's disease was named after the German doctor Alois Alzheimer, who first described the disorder in 1906. The older a person gets, the higher their risk of developing Alzheimer's disease. Only about 1 or 2 people out of 100 have Alzheimer's at age 65, whereas 1 out of every 5 has the disorder by age 80. As many as 6.7 million Americans are living with Alzheimer's disease in 2023. According to the Alzheimer's and Related Disorders Society of India, ARDSI, an estimated 4.8 million people are living with Alzheimer's disease in India in 2023. This number is expected to increase to 14 million by 2050. So, that leads to an important question: what is Alzheimer's disease? Alzheimer's is a disease that causes dementia or loss of brain function. It affects the parts of the brain that are important for memory, thought, and language. The brain of a person with Alzheimer's contains abnormal clumps of cellular debris and protein that are plaques and collapsed microtubules that support structures inside the cell. Microtubule collapse is caused by a malfunctioning protein called tau, which usually stabilizes the microtubules. In Alzheimer's patients, tau proteins instead cluster together to form disabling plaques and tangles. These plaques and tangles damage the healthy cells around them, leading to cell death. The brain also produces smaller amounts of neurotransmitters, such as acetylcholine, serotonin, and norepinephrine, which allow nerve cells to talk to one another. The most common form of the disease, which strikes after age 65, is linked to the apolipoprotein E, popularly known as the apoE gene on chromosome 19. Scientists don't know how apoE4 increases the risk of developing Alzheimer's. They do know that everyone has apoE, which comes in 3 forms. One of the forms is apoE4, which increases a person's risk of developing Alzheimer's. The other 2 forms seem to protect against the disease. While people who inherit the apoE4 form of the gene are at increased risk for the disease, they will not necessarily develop it. Mutations in genes found on chromosomes 1, 14, and 21 are linked to rarer forms of the disease, which strike earlier in life. This leads to another question: how do people get Alzheimer's disease? Scientists don't know exactly how people develop Alzheimer's, but they believe a combination of genes and environmental factors causes it. In other words, it is a multifactorial disorder. The early onset forms of Alzheimer's are inherited in an autosomal dominant pattern, which means that only one parent has to pass down a defective copy of the gene for their child to develop the disorder. Now, a question may come to your mind: what are the symptoms of Alzheimer's disease? Because Alzheimer's destroys brain cells, people with the disorder slowly lose their ability to think clearly. At first, they may forget words or names or have trouble finding things. As the disorder worsens, they may fail to do simple tasks, such as walking to a friend's house or brushing their hair. Some people with Alzheimer's also feel nervous or sad. That raises another critical question: how do doctors diagnose Alzheimer's disease? There is no single test for Alzheimer's. Doctors use several tests to check a patient's memory, language skills, and problem-solving abilities. These tests don't diagnose Alzheimer's, but they can rule out other disorders with similar symptoms. So, it leads to another critical question: how is Alzheimer's disease treated? There is no cure for Alzheimer's, but a few medicines can slow its symptoms. A drug called Aricept increases the amount of the neurotransmitter acetylcholine in the brain. Another treatment, Namenda, protects brain cells from a chemical called glutamate, which can damage nerve cells. Doctors may also give their Alzheimer's patients antidepressants or anti-anxiety medicines to ease some of their symptoms. People with Alzheimer's often need a caregiver, someone to help them do the things they were once able to do themselves. Thank you for joining me in this unique journey of learning. If you have any feedback about this video, please comment below. In the future, we will again meet with a new innovative topic.